Hello, class. So we are going to go through the notes for bones on today. I will also have those open on the content page. I have some people coming to do some work on my house, so if this splits at any point, I will pick it back up where I left off. It might be more than one recording, but that would be why if they end up ringing the doorbell in the midst of this. So make sure you go through all the anatomy. You got to spend time on that anatomy. Same thing with muscle. Okay. If you have any questions, as usual, jot them down. Always email me and ask me if you need to meet with me. We can do that. So I'm going to turn me off and we're going to get started with um, the notes here. So the first thing is that we know we got two parts to the skeletal system. We got the axial skeleton and the appendicular skeleton. So the axial is in the white here, right? The head, neck, and the torso. And then the appendicular makes up the appendages. That's why they have appendicular appendages, right? And so the axial skeleton is referred to as the bones that form the longitudinal axis, right? This straight up and down here. And so that's the head, neck, and the torso. And then the appendicular skeleton is the bones of the limbs and then all of the bones that keep them attached to the body. Those are the girdles. Okay. And so we'll get into that. So what is bone for? Well, you know, bone is our framework, it's supportive, and it's protective, right? So our brain is totally encased in bone. We got some protection for our heart and lungs by bone. You know, it's our scaffolding or our framework. Our muscle is attached to bone. And because our muscle is attached to bone, that also allows for movement. So the muscles contract, right? And that is providing the movement, but the bones act as levers for that movement. So the bone and the muscle work together for that. Bone is for storage, and we always appreciate the storage of calcium, but we also have phosphates. We also store fat within the bone. So actually, in adult long bones, the marrow cavity has fat. Now, in infants and children, all of the marrow in the bone is red marrow, which is blood producing. So we produce blood in our bones. And then in adults, the flat bones and the epiphyseal ends will have the red or blood producing marrow. And then the shaft of the bone, the diaphysis, the narrow cavity or medullary cavity, there will have fat. Okay. And so you see this illustration here. I'll zoom in on that. And it just shows the different aspects, right? Protecting the organs like the brain, storing fat in the marrow cavity. This is showing some red marrow in the epiphyseal ends where we produce blood. The storage of calcium, calcium phosphates in the form of hydroxyapatites is how we store that calcium and phosphate. Facilitates movement, right? Forming the joints, and the muscles attach across those joints that allow movement and then support and scaffolding or framework for the body. Okay. How are we classifying bone? Two ways. We classify bone based on shape, and then we classify bone based on the type of bony tissue. So shape and size and the type of tissue. So when we think about the type of bony tissue, we have compact bone and spongy bone. Compact bone is very well organized and dense. So when you looked at the tissue slides, when we did tissue, and that tissue that had bone and it looked like tree rings, that's compact bone. So those tree ring looking structures are called osteons or Haversian systems, and they're packed tightly together and they form compact bone, which is dense. And spongy bone actually is more porous and looks like a meshwork or looks like a sponge, and it's less dense. And then we classify bone based on shape and size. So we got long bones, short bones, flat bones, and irregular bones. Let's blow up this picture and look at that. So long bones are longer than they are wide. Short bones are more cube shaped. Flat bones have two layers of compact bone, two thin layers of compact bone with spongy bone sandwiched in between. And irregular bones are oddly shaped and don't fit into any other category. Now I'm going to repeat that, and actually I'm going to put it on here because I want you to write that down. Okay, long bones are longer than they are wide. Short bones are more cube shaped. Flat bones, and I need to kind of make it clear that this is for that. Okay. So flat bones are two thin layers of compact bone with that spongy bone sandwiched in between. And irregular bones are oddly shaped and don't fit into any other category. Okay. Let's zoom in and look at this picture. So we have short bones. You can see they look a little bit cube shaped. So the example here will be carpals, tarsals, even the patella will fall into short bones. Flat bones, we have the bones of the skull. They're usually thin, flat, and curved. I didn't mention that, but they're typically curved. And they have two layers of compact bone with a layer of spongy bone sandwiched in between. So these include the bones of the skull, it includes the sternum, it includes the ribs. Those are considered flat bones because they're more flat and they have the two layers and the curve. Let's see. Long bones, obviously, they are longer than they are wide. Now that doesn't mean they are a specific length because even phalanges, the bones of the fingers, are considered long bones because they're longer than they are wide. So the patella is part of the short bone. And then irregular bones, the vertebrae kind of fall into the category of irregular bones because they're oddly shaped. They don't fall into any of the other categories. This picture shows sutures. Sutures are joints between these flat bones. They're immovable joints between the flat bones. Okay. Now, this is a picture of compact bone. So I'm going to zoom in. And this is what you saw on the picture. So you got these osteons or Haversian systems. So here's one, and 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 here's one, right? And here's one, and here's one, right? And they're packed tightly together. And so you have this bony tissue laid down forming these rings. So you got rings creating the osteons, and you also have bony rings that go all the way around the entire bone. You also have a little bit of spongy bone in the inside lining the marrow cavity. So you see that. Okay. You have some spaces here through which blood vessels flow. So in the center of the osteon, you have a canal here that is parallel with the length of the bone. And then you also have canals that run perpendicular, right? So you got some that run parallel and some that run perpendicular. And so we're going to name all of these things in a minute. Okay. Let's see. While we're looking at this, so while you're looking at these bony rings of tissue, right, you can see these little areas here. It almost looks like bugs and bug legs, right? Okay, the spaces here are called lacunae, and they have cells sitting in them. The cells that sit in there are called osteocytes, and these little extensions are called canaliculi. Okay, we're going to talk about that more in a second. So if we move over a little bit, this shows that blown up. Okay, so the space is darker, right? And you see the space around here. That's the lacunae. This is the cell sitting in the space, the osteocyte. And so then these extensions from the cell pass through these little canals. Those canals are called canaliculi. Okay. When we move down, the outside of the bone is covered with the connective tissue covering called periosteum. And the periosteum has these fibers that penetrate the bone to keep the bone, keep the periosteum attached to the bone. Those are called Sharpie's fibers or perforating fibers. Okay. And then this is an up close. Now we have some other bones associated, some other cells rather associated with bones. So we have osteoclasts, osteoblasts, and osteocytes. Okay, I need you to write some notes down here. Osteocytes maintain bone. Osteocytes maintain bone. Osteoclasts, C-L-A-S-T-S, osteoclasts break bone down. And osteoblasts build bone. You got osteocytes, osteoclasts, osteoblasts, and osteoblasts, B-L-A-S-T-S, build bone. Okay. So let's look at this picture again and name the things on here. Okay, so I am going to kind of colorfully mark these things as we're talking about them. So each one of these circular structures is called an osteon or Haversian system. In the center of each osteon is the central canal or Haversian canal. Central canal or Haversian canal. And they've labeled it here. Then the canals that run parallel are called perforating canals or Volkmann's canals. They label it here. The rings of bony tissue are called lamellae. So you got circumferential lamellae that run around the whole circumference of the bone. And then you have lamellae, that is the lamellae that makes up the osteon. Concentric lamellae. And I'm really not concerned about you differentiating between circumferential and concentric lamellae. I just need you to appreciate that you got lamellae that runs around the whole bone and then lamellae that makes up the osteon. Okay. And then you have the spaces in which the cells sit. That's the lacunae space. The cell itself is an osteocyte, and the extensions here, they actually allow for oxygen and nutrients to make their way from the central canal out to the cells sitting in those spaces. Those are called canaliculi. You see that label there. Okay. While we're looking at this, let me flip for a second. I'll probably be flipping back a little bit back and forth. Oh, a minute. Oh. Okay, well, let's just look at this while I have this up here. So here is spongy bone. Let's zoom in on this so you can get a good look at this. So you can actually see the bone here in the epiphyseal ends is spongy. It looks spongy. And then the compact bone, you can see that there's no space between the bony tissues here. It's all packed tightly together, right? So you can appreciate that different tissue. So compact on the outside, spongy on the inside. You can see compact on the outside here, spongy on the inside. Let's see. We're going to come back to that long bone in a second. I wanted to go to, I thought I had, okay, here we go. Here. Okay. This is a model of that thing we were just looking at, that section through bone, right? So each one of these circular structures is an osteon, right? And the rings of bony tissue are lamellae. And then you also have lamellae that comes around like that. Okay, let's go back to the other side. So these are the rings of bony tissue. You see that? That's lamellae. Here's the periosteum and the Sharpey's fibers. Let's zoom in on this. These spaces are lacunae. You got cells sitting in there. This really looks like bugs and bug legs. The cells are the osteocytes, and the legs are the extensions going through those canaliculi. Okay? You have the central canals that run through the osteon, and then you have the perforating canals that run almost perpendicular. Okay? Let's see. Okay, you can see it a little bit here. I'm going to zoom in. So again, you see this periosteum out here and the Sharpey's fibers to keep it attached. On the inside, we have a connective tissue lining, and you see it in gray over here. This is end osteum. End osteum is the lining inside of the marrow cavity. So let's just make a note here. Okay. So you got a connective tissue covering on the outside, that's periosteum, and the Sharpie's fibers keep it attached. And then on the inside, you have a connective tissue lining called endosteum. Okay. So bone is made up of organic and inorganic components. The organic components are the cells, right? Osteoblasts that build bone, osteoclasts that break bone down, osteocytes that maintain bone, and a material called osteoid. An osteoid is made of proteoglycans and glycoproteins and collagen fibers, um, and it's organic, right? It's made from the osteoblasts, and this is kind of where bone is built, right? The stuff that bone is built up or built from, and you got the inorganic components that makes up 65% of bone. That's the calcium and the phosphates, right? The hydroxyapatites. Okay. And the hydroxyapatites create these crystals that allow for this material to be packed really tightly together and have a lot of strength without it being brittle. Okay. So our structure for the hydroxyapatites and our organic components together give our bone that strength, that durability, prevent it from being brittle and easily broken. Bone is really, really very dynamic. It's very regenerative. If you break a bone and you don't go to the doctor and get it set and lined up and um, you know, so that it can heal properly, it's going to heal on its own. Bone is always considered to be remodeling. So that means it's always breaking bone down and always building bone up. It's just that's just the nature of bone. It is very regenerative. And this is why breaking a bone heals faster than tearing a ligament or a tendon, because there's no direct blood supply to a tendon or a ligament, but lots of blood vessels within bone. We don't think about bone being bloody, but it really is, right? And the bone is producing blood. So we have marrow inside, and the red marrow is the blood producing marrow. And in infants and children, you can see in this picture here, all of their bones have red marrow, right? For the most part, as they are growing and developing. And then as we get older, some of those areas that have red marrow start building up fat. And that's particularly in the long bones, right? And so when we get to be adults, the red marrow would be in our flat bones and a little bit in the epiphyseal ends of long bones. Okay, now this is going to be important. One thing that this is kind of misleading right in here. That ilium, you remember your oscoxia is made of three bones: ilium, ischium, and pubis. And if we categorize them based on shape, they would probably fall under the category of irregular bones. A lot of times that's how the textbooks categorize them. However, that ilium by itself is considered a flat bone. And if you're going to donate marrow, that's where they're going to pull it from. Okay, so that ilium is a flat bone in the hip, and it has red marrow, even in adults. Okay, so that's really not going to be so yellow. As we get older, it might have less, but even as an adult, that's where that red marrow is from. Even as a middle-aged adult, for sure, there's still significant red marrow there. You have to have blood producing um, tissue. This makes it look like there's almost none. That's not the case. Okay. Yellow marrow will then fill those long bones as we get older. So the medullary cavities or the medulla or marrow cavities of those long bones is going to have fat. Okay. So what did we find in that compact bone? We just looked at that. So we had our osteocytes, right, which were those cells that maintain bone. We also had osteoblasts and osteoclasts. Osteoblasts build bone, osteoclasts break bone down. And then we have the lacunae, which are the spaces in which the cells sit. We have lamellae, which are the rings of bony tissue. We have the Haversian canal or the central canal in the middle of an osteon or Haversian system, and those run parallel to the bone, and obviously blood vessels run in those. And then perpendicular to the Haversian canals are the Volkmann's canals or perforating canals, blood vessels run in those. And then we have the canaliculi, which are the extensions to and from those lacunae from the central canal, so that oxygenated blood and nutrients can get to those cells sitting in those spaces. Okay, and so then this is the same thing we just looked at, a couple of different pictures. Okay, so we got our epiphyseal end, we got our diaphysis here, and we have pulling out of the diaphysis an area, they have a chunk right there that they're pulling out. So you see the arrow that's indicating they're pulling a chunk out, and they blow up this compact bone. So let's look at it one more time here, where we have the lamellae here, here. The whole thing here is an osteon. In the center are central canals, right? And then we have perforating canals. We got our periosteum and then Charvet fibers keep it attached. Lining on the inside, we have endosteum. Let's see if our other picture shows that better. Yeah. So we see this endosteum inside here, that pink, that layer represents the endosteum. And then we have our cells sitting in the spaces. So the spaces are the lacunae, the cells sitting in there, osteocytes, and then you got the canaliculi, which are the extensions that allow for nutrients to get there. Let's see. I want to make sure I didn't miss anything. I think we're good. Okay. I want to go back to this other set of slides. So we just talked about those things. I want to backtrack a little bit because I want to fill in that picture. But I want to talk about the long bone. Let me see if there's anything else I missed that I want to talk about. I think we categorized those. Okay, here. There's a couple things, and I apologize for flipping back and forth here. I had a couple of different lectures, and I saw value in both of those made up, and so I just wanted to make sure I cover everything. So when we talked about the classification where we had appendages making up the long bones, I think I didn't give examples. Short bones, well, I think we looked at them, but we got the carpals and the tarsals. Flat bones, the bones of the skull. Irregular bones, vertebrae. I didn't give you this one, pneumatized bone. This is bone that is hollow and has air in it. And an example of that would be the ethmoid bone. So you can put that one down. Okay, and we looked at the pictures like that. We looked at that. Now, the long bone. This is where I want you to make sure you get this information down. So I mentioned the diaphysis and the epiphysis, and let's go back and define what that is. So the diaphysis is the shaft of the bone. That is the long part of the bone, and it has a lot of compact bone, and then it has the marrow cavity inside. Okay, so the diaphysis is what's covered by that periosteum, and it's lined on the inside with the endosteum. And so we talked about two types of marrow inside, right? Red and yellow, and I'll just put red and yellow, but you already have the notes for that. We talked about that on the other set of slides. And then at the ends, we have epiphyseal ends. The epiphyseal ends are the proximal and distal portions of the bone. They're covered with articular cartilage, which is hyaline cartilage. So if you've had chicken and you had the gristle is that hyaline cartilage. Okay. And this is where we form points of articulation. Remember when we were talking about the anatomy, I said articulation is where they come together or they join together. And then where the epiphysis and the diaphysis meet is the epiphyseal line or plate. Now, if the individual is still growing, that is a plate. If they are done growing, then it's a line. Okay, so the remnant of that area is a line. So if you were some kind of crime scene investigator, right? You know, you watch all these shows and you find some skeletal remains and you look at those epiphyseal ends or the areas where the epiphysis join the diaphysis, you can have an indication of the age of that individual, at least whether or not they were an adult or not, right? Because where the epiphysis and the diaphysis meet, if there's any cartilage there, then there's still growth happening. That's an epiphyseal plate. And if there's just a connection between the two, that's an epiphyseal line. That is an adult. No growth still occurring there. Okay. So now let us draw our bone in. I always do this. So I want to put on my periosteum. This is my covering on the outside. And the periosteum has those tiny Sharpies fibers that keep it attached. So this is a nondescript bone. So this is not any particular bone, right? This is just a generalized bone. Okay. On the inside, we have connective tissue lining, which is the endosteum, right? On the outer surface of the epiphysis, we have a hyaline cartilage covering here. That is called articular cartilage, and we're going to label all these in a minute. And then we have an area here where the diaphysis and the epiphysis meet. That's going to be our epiphyseal line or plate. So let's create some lines to label these. So got that, got that, we got that, that, that. Okay, so this is that. Well, this is the marrow cavity. And then this is the diaphysis. These, oh, let me do it the other way. Oh, I'll just do it this way. These are epiphyseal ends. Diaphysis. Epiphysis. And the diaphysis is covered with periosteum. And to keep that periosteum attached, got Sharpie's fibers. The lining on the inside is end osteum. The cartilage on the outside of the epiphysis is the articular cartilage. And it's made of hyaline cartilage. And then we have epiphyseal plate or epiphyseal line. You want to make sure you draw that. I'm going to give you a second to look at that. Okay. So then this is that picture. We're going to zoom in on it. So this is my long bone. This long part is a diaphysis. Let me, so we got the diaphysis here, all right? And then we got the epiphyseal end here. Epiphyseal end is made of spongy bone. Diaphysis made of compact bone with the marrow cavity inside. This is an adult. You got yellow marrow in there. We got the epiphyseal line. So that's all bony tissue. So no growth happening here. So this is an adult. And then we got the periosteum on the outside here. And so if we take a chunk out and look at it, you can see the articular cartilage on the surface. And actually, this probably is a lot thicker than they've made it. Articular cartilage. And then you see the bony tissue here. So we got a layer of compact bone and then spongy bone inside. This is out of our epiphyseal end. Then when we take a section out of the diaphysis, so they've taken a section out and they've blown it up here, you can see each of the circular rings here represent the osteons in our compact bone. You can see our periosteum is being pulled away here. You see the Sharpie's fibers. They're showing you the lining, and here is the end osteum. You see our yellow marrow inside of the medullary cavity. And each one of these circular structures is an osteon making up compact bone. Okay. Let's see. Okay. I'm not sure if this is on my other set of slides, so we're just going to look at it while I'm on this set. So we have bone markings. Some are projections. We got some processes. Then we have some depressions or openings. And so we got tuberosity, crest, trochanter, line, tubercle, epicondyle, spine, head, facet, ramus, condyle. These things are for either forming joints or ligament and muscle attachment. So the ones that with the asterisk next to them are for muscle and ligament attachment. The ones with the little clover are for forming joints. Then we have depressions and cavities that allow for blood vessels and nerves to either sit in the depression or move through. Meatus, fissure, sinus, foramen, fossa, groove. Okay. Okay, so we looked at that. This was like the slide that you saw before in class, right, for tissue. So those rings of tissue, each one of these circular structures is an osteon. The dark middle part is where blood vessels run. The rings are the lamellae, then the little dark spots all over are the lacunae with the osteocytes sitting in them. Okay. We looked at that. We looked at that. We looked at that. Okay, this is a good view because it shows the endosteum. So that light gray on the inside, this is a chunk out, and this would be the marrow cavity somewhere in here, right? And so this is a blow up of that bony tissue. Okay, let's see. Okay, let's go back to my other set of slides. Okay. Now, with regards to bone development and growth, we talk about bone development or bone growth with a couple of terms: osteogenesis and ossification. Okay, and so this has to do with bone growth and development. So bone can grow in length, and that typically is genetically predetermined unless you have some kind of pituitary issue, like giantism, where they just keep releasing a ton of growth hormone, for example. But for the average person, your height is already genetically predetermined, and your bones are only going to grow to a certain length, right? The thickness of bone, of course, there can be a pituitary issue there where you get this um, abnormal thickening, but thickening of bone can happen throughout life, um, and it can be important with regards to preventing osteoporosis or doing all that you can to thwart off the effects of osteoporosis. Like osteoporosis can affect anybody, male or female, any race of people, but oftentimes the people who are more affected by osteoporosis are Caucasian females that happen to be thinner. And one of the things that you can do while you're young, of course, is to have adequate calcium in your diet, but also weight bearing exercises. So you don't have to gain weight, but you need to do weight bearing exercises to cause your bones to thicken and strengthen. Okay. I mentioned earlier that our bones are constantly remodeling, right? So that's where you have osteoclasts breaking bone down and osteoblasts building bones up. And this, excuse me, why bones are able to repair pretty rapidly. Okay. Now, two types of bone growth: intramembranous ossification. And this is typically where we're talking about the formation of flat bones. The tissue forms from a fibrous membrane. So we start with this fibrous connective tissue, and then we have that osteoid, that organic material that is going to be secreted in that membrane, and then it's going to calcify. So it's going to build up calcium there, and then it's going to harden or ossify. And then more osteoid is going to be laid down between blood vessels and form kind of a woven network. Okay. And we'll see a picture of this in a second. And then you'll have rings of bone laid down as well, and that's going to be more superficially. I'll give you a second to write those things down, and then I'll show the picture. So where you have this intramembranous ossification, so you have this um, osteoid area, right? And you have mesenchyme is undifferentiated tissue. And so here we have some cells that are going to become bone cells or bone related cells. We got osteoblasts on the outside here, and we're laying down bony tissue in the middle here. Let's look at a better, I think I got some better pictures here. Okay. So here is my ossification center where we got this fibrous connective tissue, and we got our osteoid and our osteoblast. So the osteoid is this little, look like little speckles in there. Let's zoom in a bit on here. We got osteoid, that's our organic material. We got our osteoblast. And so the osteoblasts are going to start to lay down bone. And so you see that happening here. So our second step is where we get the osteoid is going to be secreted more, and we're going to start to lay down bony tissue or bony matrix. Okay. And so those osteocytes, some of them are going to get trapped in there. Well, the blasts will get trapped in there and they'll become osteocytes. Okay. And then here is where bone starts to lay down around the blood vessels. And so then that is where we get this woven kind of matrix. And then we get some periosteum forming around the outside. And we get the compact bone here. On the outside. So then you still have your osteoblast here laying down bone on the surface. Let's go back through that. Okay, so we got our 4 steps. Ossification, center forms, the osteoid is secreted, and we start to have some calcification. And we start to have this blood vessels interwoven, and then we start to lay down our lamellae. So here we have our ossification center form where we got our fibrous connective tissue. We got our bony matrix. So the osteoid is going to be secreted and we get some mineralization happening. And then we get our bone woven around our blood vessels here. Okay. And then we get our what's referred to as a collar of compact bone laid down on the outside. Okay. Then we have endochondral ossification. Endochondral ossification is where we start to make long bones. And so, of course, all of this bone development starts in the womb prenatally. And for endochondral ossification, we start with hyaline cartilage template. So we start with something that is kind of in the shape of a long bone, but it's made of cartilage. And then it's going to be replaced with bone. So this starts about the 2nd month of gestation. And so we start with a bony collar that starts to form around the diaphysis of this hyaline cartilage. And I'm going to show you pictures of this. And then that center of the cartilage starts to create space or cavitates, and it'll start to calcify. Then you'll have blood vessels kind of infiltrate that area in the center, and that's called a periosteal bud. And that bud is going to have blood vessels, lymphatic vessels, nerves. and that's about the 3rd month. And then diaphysis is going to elongate. We get our marrow cavity or medullary cavity. And then the last step is for the ossification of the epiphyseal ends. Okay, so here, and don't worry about this growth factor. Let's zoom in on this. So here is our start. Mesenchyma is undifferentiated tissue. And then here's my cartilage outline here. Okay, so this is cartilage. And it's kind of in a bone shape. And so what starts to happen is I start to lay down bony tissue around the outside. So you see that happening here. That is my bony collar. And the inside starts to cavitate, right? So you see some space developing there. And then here's my periosteal bud, right? And you can see that starting to infiltrate the bone here. And you start to see bone replacing the cartilage. And so you see that calcification happening along the epiphyseal ends, and you see it obviously all up and through the diaphysis. Let's see if I have another picture. Yes. Okay. So here's my cartilage form, if you will, and I start to get this bony collar on the outside. And then the inside, I start to have some calcification and cavitation happening. So I'm starting to create a space in the middle and lay down some bone in the middle. And then here's my periosteal bud that infiltrates that inner portion. And you can see all of this middle part becomes bony. And then my epiphyseal ends start to lay down bone. And so then I end up with some cartilage staying around the epiphyseal ends. And then I have some cartilage here at the epiphyseal plate where growth is taking place. And then, so the bone is pretty much formed, and the continued growth would happen at the epiphyseal plate. Okay. So we got formation of the bony collar. We got cavitation. We got the periosteal bud coming into that center, right? And then we get epiphyseal ossification. Okay. Let's see. I don't think I talk about that on this one. This is mainly talking about anatomy. Okay, we'll come back to those fractures in a second because I think I talk about this on this one as well. Okay. When we talk about growth of cartilage, we have appositional growth, growth from the outside in, and interstitial growth, growth from the inside out. I'm really not going to go into any of this detail. Just know those definitions. We have too much stuff to cover for bone and muscle to focus on all of the detail of that. But you do need to know the two types of bone growth. Okay, bony fractures, simple, closed, compound, comminuted, compressed, depressed, impacted, spiral, green stick, stress fractures, epiphyseal fractures, avulsion. So this is an illustration that shows some of those let's zoom in and I'll go back to my other set of slides, I think, where I have some things written out. Transverse, oblique, spiral, these are all simple, right? One fracture across the bone, or closed, you don't break the skin, okay? Comminuted is more than one break. If you have a compound fracture, that means that you've broken the bone and the skin, not that you have more than one break. So a compound fracture is you've broken the bone and you've broken the skin. Comminuted is where you have more than one break. Avulsion, one of the processes has come off. So you got, you know, a condyle or something has broken off here. Impacted fracture, this is not necessarily the best illustration of that. Impacted fracture is when, for example, you try to break your fall and you put your arms out, and this is a common one, particularly with older people. They'll put their arms out and they try to break a fall, and the ends of the bones are pressed into one another. Don't worry about Taurus. Green stick is an incomplete break. So you have it partially broken, but not all the way. So the term green stick comes from, like, if you have to get a switch, for example, off of a bush or a tree or something, and if that branch is fresh, it's still green, and it's hard to break it. Like, it's easier to break a totally dried twig. Compressed fracture, you see that you have compression there, where those the bone is kind of crushed or pressed in, compressed. Depressed fracture, you have crushed the bone and it's pressed in. So compression, bone is crushed, but here the bone is crushed and pressed inward. This is a compound fracture in that they're showing it's broken the skin. I don't really like that picture either. Let's go to my other set of slides here. I'm going to give you a minute to write those down. And we'll look at the pictures I have on this one. I think they're a little bit different. Let's see if I have any pictures here. So you got compound. This one shows that is open. It has broken the skin. And then closed, simple break, doesn't break the skin. Compressed, the bones are compressed. Impacted, so you see bone is pushed into another bone. Comminuted, more than one break. Avulsion, we've broken off a little piece of the bone here. Green stick is incomplete break. Okay. This one is epiphyseal. We didn't look at that before. Okay. Fracture repair. So you might have a displaced fracture or a non-displaced fracture. If it is displaced, that means the ends of the bones are not in normal alignment, so they have to be realigned. If it is non-displaced, that means the bone is still in its normal alignment, and you don't need to have the bone set, if you will. So when we talk about set, the term for that is reduction. So a closed reduction can be done manually, where the physician actually manually moves the bone without being invasive, just kind of moving your limb, for example, to get the bones back in place. And then they would do something to immobilize it. An open reduction is where there's actually a surgical procedure. You got pins, wires, sometimes plates, those kinds of things, and then you have immobilization so that the bone can heal. And so they're showing that here. So this is an open reduction where we have some surgery going on. So you see plates and screws and stuff in there for that break. A closed reduction, the bone is not out of alignment. They just put a cast or something around there to keep it from moving and allow for healing. But with this open reduction, not only do they have to fix this, repair the damage, then they cast it and immobilize it. Okay, so that's open, and then this is closed. Okay. Okay. So let's talk about fracture repair. So we talked about the different types of fracture, but what happens when the fracture is actually repairing itself? What actually happens? So there are 4 steps involved here as well. And we have first a hematoma formation, which is clotting, a bruise, where you actually had the damage. And that's going to stop the bleeding out of the damaged vessels. And then we have a fibrocartilaginous callus formation. And so that's where we get some granulation tissue there that is going to start to build some tissue around the area, develop some new vessels, or the vessels will anastomose, which means that they're going to join together. And then we get some fibers, some fibers laid down, some collagen rather, fibers laid down. And then we have a bony callus form. So now we have osteoblasts starting to lay down bone. And then we get the remodeling where we actually get that restructuring of bone. Let's zoom in on this picture. So here's where we get the bruising. We stop the bleeding out of the damaged vessels here, right? And then we start to lay down some callus. That's the purplish kind of color in here. And you can see that we're starting to have some anastomosis of blood vessels and some bony tissue laid down. It's called trabeculae. Trabeculae is a term where you have that mesh work. Each little branch of mesh, if you will, is trabecula. So you got the trabeculae where the bone is starting to come together with the other end, and then you have the vessel starting to anastomose and come together to reattach those damaged vessels. And then we get that bony callus. We actually start to get more bone developed in here. So we get that bony callus formation. So you see that bone laying down in there. And then we get the total repair healing. Now notice that, let me move this over a bit. After the damage, the bone is not exactly perfect, right? So it doesn't go back to being perfect, but it is pretty good, right? Once it has been set and the tissue is laid down there. Okay. Okay. So the thing I want to talk about here is where the bone stores and releases calcium. But before I do that, let me flip back to my other set of slides here and see, was it anything else I wanted to get into? We talked about that. Okay, we'll come back to this and we'll talk about joints in a second. Okay, but I'll finish this one out. Okay, so bone we know produces blood. We know it stores calcium, but it also can release calcium if we need it. This is why it's important to have calcium in your diet so that we aren't actually pulling calcium out of our bones. Okay, so let's zoom in on this. We're going to do two separate flow charts, but this first one shows both of them together. So when we have an increase in blood calcium, let's say you have a milkshake and a cheeseburger, dairy products have calcium. So blood calcium is going to go up, right? Blood calcium goes up. The sensor or receptor for that is the thyroid gland. As a control, the thyroid releases a hormone called calcitonin. Calcitonin causes the bone to absorb calcium, and then we go back to normal blood calcium levels. Okay, this is a negative feedback mechanism. Remember the difference between a negative feedback mechanism and a positive feedback mechanism. A negative feedback mechanism turns off the original stimulus to take us back to a normal range. A positive feedback mechanism will increase that original stimulus and keep increasing it until we get a desired outcome. Okay, let's say you've been having Twizzlers and Coke all weekend. What happens to your blood calcium levels? They fall. The sensor or receptor for that this time is the parathyroid gland. As a control, the parathyroid gland releases parathyroid hormone. That stimulates the bones to break down and release calcium. And then we go back to normal blood calcium levels. This is also a negative feedback mechanism. Okay, now let's fill them out one at a time. So let's say you have had milkshake, cheeseburger, or you had macaroni and cheese and milk, or some kind of dairy thing, right? What happens to your blood calcium levels? Blood calcium levels go up. The sensor or receptor for that is the thyroid gland. As a control, the thyroid releases calcitonin. And that calcitonin stimulates the bone to absorb calcium. Right, we go back to normal blood calcium levels. Take a minute and get that down. Okay, now what happens if you've been having Twizzlers and Coke all week? Right, Coca-Cola. Okay, so, and I use those because they don't have calcium. So your calcium drops. Right? Blood calcium levels drop. This time the sensor or receptor is the parathyroid gland. And the parathyroid gland releases parathyroid hormone. That's what PTH is, parathyroid hormone. And as a control, the calcium comes out of the bone. Okay. This is also a negative feedback mechanism. So you take some time to write that one down. Okay. Okay, now this is how the blood is stimulated to be produced in the bone. So we got another flow chart to write down here. Let's zoom in. Okay, so what happens is when blood oxygen levels get low, the kidneys will detect that and they release a hormone called erythropoietin. That's what this EPO is. I'll spell it out on the chart. Erythropoietin. And then the erythropoietin stimulates the red bone marrow. And of course, we should see red marrow here. And it would be red marrow in the diaphysis if it was an infant or a child, maybe in epiphyseal ends in an adult, but surely in flat bones in an adult. So let's put this down here. Okay, this is for okay. So oxygen levels get low. Come on. The sensor or receptor for that is the kidney. Move our picture down a little bit. As a control, the kidney releases erythropoietin. Come on. My text box keeps jumping around. The erythropoietin is going to stimulate our marrow to produce more red blood cells. And then we go back to normal blood oxygen levels. This is also a negative feedback mechanism. Okay, get that one down. Okay. Now, let's go back to my other set of slides. Okay, we already talked about the axial and appendicular skeleton, but let's put some detail to that. So we have the skull and the vertebral column and the bony thorax making up the axial skeleton. The skull has two sets of bones, the cranium or the cranial bones and the facial bones. I did mention that, but I didn't use the phrase two sets of bones. Okay. The vertebral column is made of 26 irregular bones. So we already said the vertebrae were irregular bones. And then the appendicular skeleton is made of the bones of the arms and the legs and the bones that keep them attached. And those are called girdles. Okay. So we've seen that, right? We saw the picture of the axial and the appendicular skeleton. Now, joints are also considered when we talk about bones. And so joints are the points of articulation. Remember, articulation, I said, is when the bones come together and fit together. And so where they touch or come together. And so these points of articulation are the joints, right? So they hold the bones together and they allow for movement or mobility. And so we have some categorization of joints based on how movable they are. And then we have some other categorizations based on the makeup of the joints. Let's say that. So we have some joints that are considered synarthrosis, which are immovable joints, amphiarthrosis, slightly movable joints, diarthrosis, which are freely movable joints. And we typically talk about those kind, and they are categorized as synovial joints. And I think we mentioned synovial membranes when we talked about tissues, and we talked about mucous membranes and serous membranes and cutaneous. Those were all epithelial. And then we talked about the synovial membrane, which is connective tissue. And so those synovial joints are those freely movable joints. Okay, so we have fibrous joints like sutures. These are interlocking and not going to allow for movement. Syndesmosis, bones are attached by a ligament. Gymphosis, tooth alveoli. Okay, so alveoli is plural, an alveolus is one, are pockets that hold something. And so we have in our mandible and our maxilla, we have these pockets that hold the teeth. And technically, they're considered joints. Gymphosis are the sockets that the teeth sit in, the tooth alveoli. And so, just a side note, we'll see alveoli again in 153 when we get to the lungs and the breast tissue, the mammary glands. So those have alveoli or pockets. Cartilaginous joints, pubic symphysis. These are slightly movable. Not a lot of movement there at that pubic symphysis. And if you've delivered a baby vaginally, you can appreciate how slight that movement is. Okay. Synchondrosis, epiphyseal plate is technically a joint. And these fall under those categories as other examples. Synovial joint is the main one that we focus on, that we look a lot at. So, example, knee joint. It could be elbow joint. It could be the shoulder joint. It could be the hip joint. Fingers and toes. All of those joints are considered synovial joints. And so this is a general makeup of those joints. So you have, let me get some color on here. So you have a synovial membrane on here. They call it synovium, that surrounds the joints, and it secretes a synovial fluid. And in this synovial cavity, this space in here, is where we release the synovial fluid to lubricate the joint. Okay. And then also, as part of the joint, we have the articular cartilage from either bone. And then we have a capsule that surrounds, and that isn't labeled here, but that's this pinkish color. That's a joint capsule that surrounds the joint. And then we have some reinforcing or collateral ligaments out here surrounding the joint to reinforce it or stabilize it. Okay. So these are the parts of the synovial joint: articular cartilage, the fibrous capsule, the joint cavity that's filled with synovial fluid, the synovial membrane, and actually I don't even have the synovial membrane up here, so let me put that in because that's super important. Right, that synovial membrane is releasing that synovial fluid. Okay. And so this is an example of that. So we have our articular cartilage. We have our synovial membrane. Oh, let me change the color here. You can't see that. Articular cartilage, synovial membrane. This is our capsule, reinforcing ligaments. This is the knee joint, so we have this other pad of connective tissue in here called a meniscus. Okay, and then we have the space in here that has the synovial fluid. So let's put some things here. Let me get a better color. Okay, and so then you got the cavity in the middle there, and it's fluid filled, synovial fluid. Okay, and again, this is the knee joint, so you got some extra padding there because there's all your weight, and those pads are each a meniscus. Okay, so this picture, and we'll zoom in and look at half at a time, is showing the different types of synovial joints. So we have a ball and socket joint, which is the hip and the shoulder joint. We have a pivot joint. C1 and C2 function as pivot joints, and also between the ulna and radius are considered pivot joints as well. Hinge joints, they only move in one direction. The elbow joint and the knee joint are hinge joints. Condyloid joints, the bones kind of slide across each other a little bit with maybe a little bit of flexibility. The joint between the radius and the carpals allow for that. And then planar joints are the other carpals and tarsals that kind of slide across each other. Okay, and then the saddle joint. The saddle joint is the most movable joint. That's the thumb, right? That thumb makes us special compared to other animals because we have that opposable thumb. And so that can move in every direction. Okay. And that is the last one on there. So I think we have covered everything. And I'll also make sure the notes are open. So go back and add anything to your notes that is not included as you watch the lectures.